Good morning, everyone, and welcome back. We're here in the wellness segment of Fresh, and we're talking with Dr. Norman Bryan and Dr. Anjana Gupta today from the dental offices here in Elkhart. And we're going to talk to Dr. Bryan in just a little bit about snoring and sleep apnea, a very important topic, and how we can help you if you have those kinds of symptoms. But right now, I want to talk to Dr. Gupta a little bit about what's coming up, Doctor, in the next couple of weeks here from your offices. You've got some pretty interesting topics coming up.
We do. In the next couple weeks, I'm going to cover some more information on cosmetic dentistry, which is a big interest today. Everybody wants that nice, bright, white, good-looking smile. So we're going to go into that a little bit deeper, talk about different options as far as treatment, and of course go back and reiterate what we've been talking about the last couple of weeks, which is overall wellness and overall oral health and dental medicine, and how ultimately that leads to that bright white smile that everybody wants.
Yes, I am so glad and happy that you are a product of the product, that bright white, beautiful smile. You've got the best in the world. Did you know that?
Thank you. I don't know about the best in the world, but thank you.
Well, listen, we're going to talk more in the coming weeks with Dr. Gupta about that. Always good to see you, Doctor.
You too, Craig. Thank you.
We want to talk to Dr. Bryan right now about things that go a little bit maybe beyond just the appearance of your teeth. In fact, it has to do with everything. It's all about wellness, Doctor. Snoring, sleep apnea, these are serious issues that many of us have to deal with every day.
Indeed they are, Craig. I think we need to make the public aware that this is a very important issue. This is something that we as dentists can provide some real important help with. Not only diagnostically now, but the therapies that we're able to provide that are comfortable therapies that will, if not totally eliminate it, will go a long way to improving the situation as far as sleep health is concerned. And we're talking there specifically about snoring and sleep apnea. Sleep apnea means basically the constriction, and normally back in the throat, back in the tongue, base of the tongue, the back of the palate, where people stop breathing at night. And those are the areas that we can really work with because we have control of that through appliances being retainer type devices that can be put in the mouth that will really go a long way to bring the jaw forward, bring the tongue forward, and stop that area where we stop breathing or where we make a lot of noise at night.
Yeah. We're going to show people that in just a little bit. But first, Doctor, for those watching at home that might be a little bit interested here, maybe something you've said has caught their ear, there is a simple little formula to kind of determine whether or not you may even be a candidate to come visit Dr. Bryan here to discuss what we can do to help you with your snoring and sleep apnea. And it's a formula that the acronym is STOP, S-T-O-P. Explain that a little bit, can you?
Well, the Academy of Sleep Medicine has provided this very simple little pamphlet. And there's, like you say, this acronym STOP. First of all, there's four things that they're looking for. First of all, are you snoring? Are you very tired during the day? Do you get sleepy during the day? Are you not getting a good restful sleep? Has someone observed you stop breathing at night, or are you gasping for breath? And lastly, blood pressure. Is your blood pressure increasing? Those are the four main issues that if you have two of those issues, you should really seek some medical assistance, or at least tell your physician, or in this case, we deal with this issue because these are very important issues. A lot of people are in denial here. Very often I see patients that say, oh, I snore, but it's not a problem. Well, it very well could be a problem, more than just a social problem. It could also be a problem that will affect your general health.
And you told me earlier that Alzheimer's sometimes can be traced right back to the snoring and sleep apnea problem?
Well, indeed. When we feel that we're not getting enough oxygen saturation, we're not breathing well at night, it not only makes the heart beat faster and harder, which means that we maybe have a greater chance of an episode of a stroke or heart disease, but there's a lack of oxygenation to the brain. When we get less oxygen to the brain, obviously we get some brain cells die. We get some changes in the overall nervous system that can cause, has been proven that people that do snore or have sleep apnea have a greater chance of getting Alzheimer's. So these are not things that we can easily dismiss, and I think it's too easy to deny these symptoms when indeed they do need to be pursued.
What's wonderful about the office here, Dr. Bryan, Dr. Gupta, is, again, that we go beyond just your dental care into total wellness, and there is a device that doctor is going to tell us about here that, boy, I tell you, when you talk about sleep studies, it makes it a whole lot more comfortable for people to use than maybe the traditional way of doing that kind of thing.
Well, that's the beauty of miniaturization today with the computers we have. We have an objective way of determining whether someone does have sleep apnea. And this is a relatively new device. It can be worn to bed in your own bed that will give us some of the parameters that will objectively tell us whether you indeed do have sleep apnea. What it does is it monitors the blood saturation level. It also monitors respiration, snoring, some of the more important aspects to tell us whether we need to pursue any kind of treatment. And this has just currently been available. And many of the stigmas of going to the hospital and going through a sleep study, we can get rid of that by simply wearing this to bed for one evening, 6 hours of sleep, and it'll give us a lot of information that will allow insurance companies to cover this, or at least allow you to understand that, yes, indeed, I have a problem.
And if you do have a problem, doctor, what's the next step then?
Well, there are several ways to pursue it, and again, it depends on the severity of the problem. Of course, as dentists and being accustomed to utilizing appliance therapy or custom-made devices that fit inside the mouth, we were able to utilize these appliances that will keep the tongue forward, keep the soft palate away from the tongue, so you can have an open airway. And that's the real key for obstructive sleep apnea. Obviously, there are some cases that go beyond that where actually a CPAP is necessary. That's a device that actually forces air down the airway. But I find in many cases, as many as 70% of the cases, this is a very effective and comfortable device to use.
And again, it just goes back to, hey, these are kinds of things that we can do at home. You can wear the appliance at home. You can use that device at home. Just a simple visit here would determine whether or not you're a candidate for either one of those. And Doctor, coming here is pretty simple. People can go to the website at myfresh.tv or make a telephone call, but you will do a complete evaluation in the very beginning, won't you?
That's correct. Every patient that comes in, we evaluate not only for sleep apnea, obviously, TMJ problems, anything that we feel in the oral environment that we can be helpful with. Certainly, we're general dentists as well. Cosmetics, as Anjana stated. These are all areas that when we see a patient, we try to advise them to the best of our knowledge of what their problems are, what we can do for them, what maybe we need to look for in the future.
All right, Doctor, very interesting information. Once again, thank you so much.
Thank you, Craig.
Dr. Norman and Bryan here at the dental offices of Dr. Bryan and Dr. Gupta. Again, if you'd like more information, myfresh.tv, or you can go to their website, which of course is available directly, or you can give them a phone call and set up that appointment today. We'll be back in a moment. Stay tuned.